I guess the only one without doctor in the title of my name starts the debate. So when I looked at the title or the subject of this debate is more government involvement the solution, it occurred to me that what we're talking about is basically one single issue, the public option. And as you know, there are 3 committees in the House that have passed bills, health care reform bills, and 2 in the Senate, as of yesterday, have passed health care reform bills. One does not have a public option, and that's in the Senate. The other HELP committee in the Senate has a public option, but when you look at the 3 bills in the House, they have varying degrees of public option. But you know, that is a really small part of our health care reform debate. Health care is complicated. It's tremendously complicated. You have all different levels of health care, everything from the most basic primary health care with your family physician to the oral health, the behavioral health, pharmaceuticals, labs, technology. It's really complicated. But at the base of this all is access to health care. Are we as Americans entitled to health care, or is health care a privilege? Well, if you look at the current affordability of health care, you would say health care is a privilege. In the United States, it is very difficult to obtain health care if you don't have employer-sponsored health care. If you have to go out and buy a policy on your own, it's almost prohibitive. If you decide that the ER is going to be your method of health care, the cost of that is prohibitive to every one of us in this room that carry health insurance, because the costs of those visits to the ER are imposed upon us as paying people who pay for our health insurance. In 2007, the United States spent $2.26 trillion on health care. That's over $7,000 per person. And it is up this year to $2.1 trillion. Up from $2.1 trillion just a year ago. So we're seeing it rising at an alarming rate. And as it's rising, we're seeing our spendable income declining at a much more rapid rate. We've got a lot of affordability issues, not only increased premiums for individuals, paying out-of-network costs. How many of you have ever gone to a doctor and then been told, I'm sorry, he's out of network? Copays, deductibles, denials for pre-existing conditions, policies that cover minimal costs, or only have catastrophic coverage. So when you go, it basically covers nothing. Unexpected medical costs, serious diseases, chronic illnesses, major surgeries, any one of those things can totally bankrupt a family. And I haven't even thrown in pharmaceuticals. But in our healthcare world, as providers, what we see is the huge cost of uncompensated care. My health centers take insured, underinsured, uninsured, and sliding fee scale patients. And we still see over $80 million a year in uncompensated care. What is our quality of health care? Well, we're paying for technology, which is the best in the world. And we're still struggling to get health information technology, making sure we have electronic health records, that we have portability so that doctors can get records from the primary care provider to the hospital in a very rapid manner if you happen to be in a horrible accident and they need your records. We're way behind on that, but that's part of our healthcare bill. And part of the healthcare bill is, how do we improve the delivery system? Do we look on the front end and focus on more primary and preventative health care so that we're not having to pay for these folks with chronic diseases and critical conditions on the back end? Do we look at educating people on how to be well and how to avoid having to go to the ER for your primary health care? We need more money for research and innovation. It's moving rapidly, and other countries are ahead of us in some of those areas. And we also need to look at workforce issues. Okay, so we get everybody covered. What are we going to do with the fact that we have few primary care providers? And every year, fewer and fewer medical students are going into primary health care. But we have people that want to be nurse practitioners. We have people that want to be physician assistants. So it's a lot more complicated. Did somebody say time? Okay. It's a lot more complicated than just, can you use your health insurance to visit your doctor?